Ethanol or drinking alcohol is a small molecules which can penetrate into every tissues in our body, and it can affect on everywhere. When it's taken orally, it can be metabolized to acetaldehyde by alcohol dehydrogenase and consequently turn into acetic acid, which are quite poisonous metabolites. Like anywhere in the body, skin can be affected by alcohol, especially certain skin conditions, including inflammatory skin conditions such as eczema, psoriasis, rosacea, and acne, and skin cancer. Generally speaking, alcohol effect on skin can be due to many reasons. Alcohol can start the process of harmful inflammation within the skin and consequently can trigger certain inflammatory conditions such as psoriasis and eczema. Alcohol can cause dilatation of blood vessels and consequently have significant impact on conditions such as rosacea. Alcohol can suppress the normal function of immune system. Finally, alcohol can disturb the normal functioning of DNA, which is a genetic center in each individual skin cell, and consequently increasing the risk of skin cancer. And also in certain type of skin cancer, such as melanoma, it can increase the mortality from them. Studies have been done, showed an association between mild acne in adolescent and drinking alcohol. In rosacea, alcohol can cause dilatation of the blood vessels on the surface of the skin, which can cause flushing and redness. Also, it can speed up the process of inflammation and can make significant changes in the gut microbiome. It can be mainly caused by one of the toxic metabolites from alcohol, which is called acetaldehyde. A type of rosacea called rhinophyma, when we can see enlargement of nose and a lot of sebaceous glands which are proliferating and can happen in rosacea. And this type of rosacea is proven to be mostly linked to alcohol. In psoriasis, alcohol can be an important trigger. It's believed to increase the chance of recurrence of psoriasis by changing the inflammatory pathway towards releasing certain cytokines, quite important role in psoriasis. It is mainly caused by the alcohol metabolites, which we already discussed. Also, alcohol can suppress the immune system and increase the risk of infection and consequently triggering psoriasis. Finally, alcohol metabolites can have direct impact on keratinocytes, which are the cells on the top layer of the skin, and to trigger psoriasis. Despite the evidence in favor of alcohol to trigger psoriasis, there is not much strong evidence to prove alcohol can develop or start the condition. We have more evidence in favor of the link between drinking alcohol in pregnancy and having babies with eczema. Interestingly, it seems to be depending on amount of alcohol pregnant ladies drink during their pregnancy. In contrast, the evidence to find out if there is any link between developing eczema and drinking alcohol is not as strong as drinking alcohol during pregnancy. In one study, they identified the link between eczema and drinking alcohol more than 2 units a day. However, the other studies did not show similar results and needs to be investigated further. The risk of melanoma can be increased by drinking alcohol, which seems to be depending on the amount of alcohol you consume on daily basis. The evidence are stronger for those people who drink white wine or liquor. Drinking alcohol can also be associated with more invasive cases of melanoma. We have similar supporting data about the role of alcohol in non-melanoma skin cancer, including basal cell carcinoma and squamous cell carcinoma. Furthermore, we have more chance of recurrent basal cell carcinoma with drinking alcohol, and also higher chance of developing squamous cell carcinoma in people who drink alcohol, which is thought to be depending on the amount of alcohol people drink.